All right, hello everybody. My name is John LaCroix. I am the owner and race director of the Human Potential Running Series. Thank you for joining me for our second clinic of 2025. This is the Medical Issues in Trail and Ultra Running Clinic. This is class number 1. It is being recorded on Tuesday, February 4th, 2025. Our second class will be on Tuesday, February 18th, 2025. And I'll get into the specifics about that here in a minute. For now, folks are going to keep coming in, so you might see me a little distracted as I make sure I welcome everybody into the room here so that we have everybody present. If you're watching this video on the recording and you have any questions, please feel free to email me. You can email me by going to our website, humanpotentialrunning.com. There is a contact button somewhere on there. Right at the top of the page is actually our email address. It's info@humanpotentialrunning.com. I'd love to entertain any questions or comments that you might have after the fact for those who are not live. So don't be shy. Would love to have your questions along the way. Okay. We're going to start with some interactive things. And let me see if I can find the thing that I'm looking for here. Okay, here we go. Okay. So the first thing I'm going to do is when you think of medical issues in trail and ultra, I want to know what comes to mind. What comes to mind for you? And you should be able to interact with this screen here. There you go. You guys got it? Could be whatever it is. Just throw your answers up on the screen and they'll appear here. There you go. So when you think of medical issues in trail and ultra, what words come to mind? What are the things that you think of the most when you're thinking of the medical issues that we might have out there on the trail? So, uh, welcome everybody. Those of you who are still coming in, we're doing a little bit of interactive stuff. It's okay to put your answers in the chat if you're more comfortable putting them there. There is a Mentimeter here on the screen. You should be able to interact with that. And we're just looking for, you can put as many on there as you want. When you think of medical issues in trail and ultra, what words come to mind? And whatever you type is automatically going to show up here on the screen. And in the chat, I see falls. I see altitude sickness. These are great. There you go. A little music for you. When you think of medical issues in trail and ultra, what words come to mind? I just want to get a feel for where everybody's at before we get into the big presentation here. I see cuts and scrapes, blisters, trench foot, broken bones, heat exhaustion, dehydration, hypothermia, ibuprofen related issues, altitude sickness, sprained ankles, nausea, cramps, overuse, nosebleeds, falls, altitude sickness. Okay. We got some more coming in. Rhabdo, tendinitis, nausea. All right. So this question is for you. It says, I personally know what to do if I or someone around me is injured. So this is for you. You personally know what to do if you or someone around you is injured. Yes, no, or maybe, depends on the injury. And I'm guessing most of you are probably going to answer maybe, depends on the injury, because a lot of you are just going to put a Band-Aid on it. Call it good. And that's okay. So if you figured out how to interact with this little doohickey, great. If you haven't, we got another yes here in the chat. We got yes, maybe. We got maybe. You can pick up to two. This is like advanced zooming for our friends who have never used Zoom before. This is pretty advanced. Okay. So nobody has said no yet. Well, that's good. Uh, how about this? I personally have received medical treatment during a race, and I'm looking for more than a Band-Aid. So more than a Band-Aid. I personally have received medical treatment during a race. Yes, no, no, but I know someone who has. So this is our another question here. I personally have received medical treatment during a race. More than a Band-Aid. Yes, no, no, but I know someone who has. And again, if you haven't figured out how to interact with the Mentimeter visible on your screen, you can put your answers in the chat. That's great. Thank you so much. I'll put a little more background music there for you. Aaron says he passed out at the IV station once, but that was after finishing, not during. That's okay. I think I would answer yes then. All right, our next slide here is rank the following injuries in order of emergence. So number one would be the most emergent injury in this list. There's 8 things. You should be able to slide them up and down, or I don't know how it's actually. I don't know. Hello from El Paso. Hello, Nikki. If you folks would figure out how to rearrange these. Oh, I'm not even sure how to do it. This is a new thing I'm trying out. Um, well, anyway, we got dislocated finger, we got wheezing and coughing.
If
We
you
have,
click on them, they start to rank.
oh, sweet. If you click on them, they start to rank. I'm trying to see how I can get to, I don't want to reset the results. Here we go. Okay. Oh, this is cool. I like how that turned out. All right, looks like so far we have severe bleeding is number one, altered mental status, confusions number two. We got a wheezing cough. And as you folks continue to answer, these will shift around. There you go. Give you folks a few seconds here to figure that out. All right, we're getting somewhere. This is pretty good. So right now we have severe bleeding as our most emergent issue. 2, altered mental status, confusion. 3, dark urine. 4, a broken ankle. 5, a wheezing cough. 6, foot blisters. 7 is a dislocated finger. And 8 is chafe skin rash. We might come back to this question later on before we end our time together today. But I thank those of you who spent the time answering that. And what do you hope to gain from this clinic? This is where you're going to be able to type in if you'd like. All right. And in the comments, I can see some more knowledge, brush up and evolve medical skills. Ooh, Michelle thinks that a wheezing cough would be second or third on our list. All right, here our answers are coming in. Refresher and learn some new tips. Knowledge of how to respond to medical situations during races for myself and others. Practical knowledge, how to deal with electrolyte imbalance. More ideas on how to help out yourself or others on the trail. I see recognize injuries easier, how to handle and be prepared for medical problems in the field. Trail racing is a different animal, so I need all the training. That's accurate. That's that's pretty good. Give you a coin for that one. Practical knowledge. Okay. And that's the end. So let's stop that. Okay. Cool. So again, this is medical issues in trail and ultra running. I think that for some of you, what you're looking to get out of this course, you're probably going to get something out of it for sure. Some of you, you're going to be looking for more, and that's okay too. I'm going to do my absolute best in helping you all out. A little bit about me before we go, and at the risk of disqualifying myself, I am not a doctor. I am not a physical therapist. I am not an exercise physiologist. I am not an athletic trainer or a personal trainer. I am an ultramarathon runner of 20 years. I have participated in 76 official ultramarathons and 50 other fat ass or journey run events. I'm also a full-time race director, and I have directed 104 events in my career to this point. I've seen some things. I'm also a certified wilderness first responder, and I first became a woofer, as it's called, WFR. I first became a woofer in 2011, and I was certified through a group called Solo. And your certification lasts for 3 years, and then you need to renew. And I didn't renew, which was a huge mistake because I had to take the course all over again. And it's a week-long course. So I took the course again in 2019, and I just did my second recertification with Wilderness Medical Associates. So I get to be a wilderness first responder. That doesn't make me a medical professional until something happens to you. When something happens to you at one of our races, I am the best thing that you have. I am the first, as it says, I am the first responder. There are not a lot of race directors out there who are wilderness first responders. And that has, the more that I've learned over the years, scares me greatly. Because the number one job of a race director is risk management. And while I can never guarantee your safety, knowing that I'm the first person that's going to be on the scene if something happens to you or one of my volunteers, I take that very seriously. So I'm also certified in risk management for outdoor programming through an internationally recognized company called Virustar. So I'm coming to you from the experience of an ultra runner of 20 years and a race director for 11. And also somebody with some medical training for the wilderness perspective, which is what we need here for when we're talking about trail and ultra marathon running. I know some registered nurses, some RNs, some LNs, some other folks who work in a hospital setting who took a wilderness first responder course and they hated it. And they hated it because they're used to having all of their bells and whistles at the hospital. And it's just different. When you're in the wilderness setting, you're kind of MacGyver. You get to figure out how to essentially ensure that somebody is stable until you can get them to definitive medical care, until we can get other emergency personnel on site. So I just want to preface with that. And again, if that disqualifies me from the conversation for you, I tried. It's free. But I really do think I have a wealth of knowledge that I'd like to share with you all. So I thank you for being here. So tonight, again, it's class 1. We're going to be exploring the 3 major systems of the human body, which is the circulatory, respiratory, and nervous system. And we're going to explore within those systems the common medical issues affecting those systems and how to identify, prevent, and treat those issues. And in class number 2, that's probably the class most of you are looking for. That's going to be the show and tell class. That's going to be where I'm actually going to show you a myriad of photographs that we've taken over the years of actual injuries of runners at our events. And where I don't have an actual photograph, Google is a wonderful tool that has allowed me to find. Actually, I've been able to find some photographs that are really close to things that I've seen that I didn't actually grab a picture of. So we're gonna talk more about the things that we've seen and fixing your feet and things like that in our next class. Just so we know where we're heading, where we're starting, and where we head. That's there for you. So again, the 3 major systems of the body are. I don't want that. Here we go. The 3 major systems of the body, again, are the circulatory system, the respiratory system, and the nervous system. And yes, there are other systems. There's the digestive system, which breaks down food and liquids into nutrients and removes waste. There's our endocrine system, which regulates body functions like growth, metabolism, digestion, and reproduction. There's our musculoskeletal system, which supports the body's weight, protects internal organs, and allows for movement. There's the reproductive system, which creates human life by producing eggs and sperm and providing a place for the fertilized egg to grow. The next one is the integumentary system, which protects the body, regulates body temperature, and eliminates waste. And our lymphatic system, which maintains fluid levels, removes harmful substances, and absorbs fats. And you might be looking at this list, you're like, oh, we went from 3 to 6 more? Yeah, there you go. So here we've got 9 different systems of the human body. And all of these are on your screen because we're going to touch on every single one of these systems a little bit in our presentation here tonight. They all do play a role in trail and ultramarathon running. So let's hop in. So first is our circulatory system. And again, the main job of the circulatory system is to transport nutrients and gases throughout the body. And the main vessels that make up the circulatory system are our heart, our blood, and our blood vessels. The circulatory system works with the lymphatic system to carry water and nutrients throughout the body. So here we can see 2 of the 9 systems that we've listed, 2 of them are working together to make sure that everything that you're ingesting during a race makes it to where it needs to go. On the right-hand side of the screen, you can see an image of a heart. And typically when we look at images of the heart, the arteries are in red and they are rich in oxygen. And veins are blue and they are poor in oxygen. The big difference between these 2 is that arteries, they take oxygen-rich blood throughout the body, and that blood carries the oxygen to the various places it needs to go throughout the body, like your muscles and your brain. And then all of that blood needs to come back into your heart to get more oxygen. So your veins are what is bringing that oxygen-poor blood back into your heart so that the cycle can repeat itself. Okay. Oxygen is vital for brain and muscle function. If you're not getting enough oxygen in, you are impairing this system. So what can help? Learning breathing techniques like Wim Hof or diaphragmatic breathing, which is belly breathing. which is breathing deeply in through your nose and exhaling slowly through your mouth. So breathing deeply in through your nose, exhaling slowly through your mouth. Okay? So diaphragmatic breathing. So there are all kinds of breathing techniques. Um, I've also seen chi running has its own type of breathing that you can do. It doesn't really matter what works. What works for you works for you. The main goal is you got to get oxygen in. So this is where things like using poles, hiking poles, becomes a great tool for trail and ultra marathon runners. Okay, I don't want that. Sorry. Um, Here we go. Um, when you have hiking poles in your hands, most people have those poles to keep yourselves upright. So if you don't have poles, maybe you're one of those folks that you're hiking up mountains and you're crouched over and your hands are on your knees and you're like really doing the grind getting up the mountain. But if you have poles in your hands, they actually can help you remain upright. And when you remain upright, it allows for maximum airflow into your airway. If you're hunched down, you're actually putting compression or pressure onto your diaphragm that is preventing you from getting as much oxygen into your body as you could possibly get. And if you're running in a trail or ultra marathon running event in a place where you're at high altitude, like here in Colorado, we need as much oxygen as we can possibly get every single time we inhale. So I am one of those persons. When I lived at sea level, I'd go to the mountains and I got my hands on my knees and I'm crouched down, powering up these mountains. And after I moved to Colorado, poles became a regular thing for me. And it's to keep me upright so that I can get maximum airflow in. So I can get as much oxygen as I possibly can into my airway so that I can get the oxygen into my blood so I can get it to my muscles. Why is that important? Your muscles burn oxygen as a part of its process to do what it needs to do. And forgive me, I'm going to try to do this course in as lay terms as I possibly can. I don't want to get into too deep medical speak for folks. I want everybody to be able to follow. Your muscle contraction, so your muscles being able to do, this, or your legs being able to walk, you need oxygen to do that. Your muscles feed off of oxygen to be able to do that. Your brain needs oxygen. We all know that your brain needs oxygen to function. So if you're not getting enough oxygen in, now you're starting to affect your mentals. You're starting to affect your brain, and you're going to have what is called an altered mental status. And I'm going to get into that in a little bit. But muscle cramping, you could have muscle twitches, muscle cramps because you're not getting enough oxygen in. So I always want folks to know, making sure that you understand how important getting as much oxygen in as possible is. Other things with the circulatory system, cuts, scrapes, and abrasions. I think we all know what a cut looks like, or a scrape or an abrasion, right? How do you prevent them? Don't fall. Don't knee a rock. Don't cut your head open on a blowdown. A blowdown is a tree that's laying across the trail and you're trying to duck underneath it, or maybe you didn't even see it and you knocked your head on it. Like typically, a cut, scrape, or abrasion is a result of a trip and fall, or you didn't see something like a tree branch or a tree that's in the way. So, how do you prevent cut, scrapes, and abrasions? Pay attention, make sure you're getting enough oxygen, and staying on top of your nutrition and hydration during a race. We tell people all the time, running an ultramarathon or even any trail race is an eating and drinking competition. You just so happen to be running. This is why the aid stations at trail races and ultramarathons are so vastly different than the aid stations on a road. At a road race, it's also a different fueling mechanism. And I'm not going to get into nutrition for runners or anything like that during this course. We did do a clinic last week on proteins for ultra runners, and we can do more nutrition clinics throughout the year. But for now, we'll just say when you're running in a road race or a marathon, it's gels and bananas, maybe some orange slices, and water and Gatorade. And those are the aid stations. And in a trail race or an ultra marathon, we've got cheeseburgers, pizza, hot dogs, cheese quesadillas, hummus and avocado wraps, Nutella peanut butter jelly, 6 different types of fruit, 9 different bottles of soda, on and on and on and on and on. It's a buffet, and that is on purpose. That is by design. And we see a lot of folks coming into trail and ultra marathon running from the road, and they have no idea how that nutritional like aspect of the race actually factors into your success level and your level of safety during the run. Your brain primarily functions on sugar, oxygen, and sugar. So if you're starting to get into the weeds with your brain, time to have some sugar. You don't need to take a gel to get that sugar. You could chew some gummy bears. You could have some Twizzlers, a Jolly Rancher. You could squirt a gel into your mouth. You could also just have sugary water. So when it comes to cuts, scrapes, and abrasions, staying on top of your hydration and your nutrition, your eating and drinking game, and making sure you have enough oxygen and you're paying attention. And that tends to cover it unless you're a total klutz. All right. Another thing that is kind of become common over the last decade, or that research is discovering, is an enlarged left ventricle. This is actually called left ventricular hypertrophy, often known as athlete's heart, which occurs due to the chronic stress of intense endurance training, causing the left ventricle muscle to thicken and enlarge slightly to handle increased blood volume during exercise. However, it's crucial to differentiate this physiological change from pathological conditions through proper cardiac evaluation by a medical professional. I am not somebody that's going to look at you and say, hey, looks like you have an enlarged left ventricle. No. However, there are many doctors in your local area who know how to test for this. There is a marker in your blood. I think it's called T strain. It's something like that. But there's a marker in your blood that they can actually test for to figure out if your body is showing signs and symptoms of having this enlarged left ventricle. Everybody knows who David Goggins is. If you don't, check in with me later. I'll let you know who he is. But David Goggins has an enlarged left ventricle. Has actually discovered that he had a hole in his left ventricle that he had to have surgically repaired. So is there such thing as too much running? Could be. Yeah. Yeah. You could do so much running that your body actually needs to make adjustments to keep up with you. And in this case, the adjustment is you are requiring so much of your heart for your endurance sport that your body is continuously having to pump more blood throughout your system, that your left ventricle actually gets stronger, as any other muscle in your body does. From repetitive, you climb mountains repetitively, your calves are going to grow. Same thing. You continue to get into ultras and this type of exercise, your left ventricle could grow. And it could be an issue. Another thing is arrhythmia. A heart arrhythmia is also known as a cardiac arrhythmia, is an abnormal rhythm of the heart. So your heart is not doing the lub-dub that it typically would do. There's a lub-a-dub-a-dub, or there's just something different about it, or a delay. And it actually occurs when the electrical impulses that controls the heart's contractions do not function properly. And yes, athletes can create a heart arrhythmia for themselves. And part of that could be left ventricular hypertrophy. So this enlarged left ventricle can cause your heart to go into arrhythmia. But arrhythmias can be caused by a wide range of factors. You could have heart disease and not know about it. Electrolyte imbalances like low potassium and magnesium. That sounds like something trail and ultra runners go through. Electrolyte imbalances. Certain medications, stimulants, caffeine. thyroid disorders, stress, smoking. I ran 100 miles with a dude once, and the first thing he did when he crossed the finish line was pull a limp, tattered cigarette out of his short shorts and smoked it right there at the finish line. What are we doing? Um, Also, alcohol consumption. This starts to bring the question, is it really smart to chug a beer or take shots during an ultra or during a trail race? Is that really the best thing that you could be putting into your body during the race? I don't mean to be Debbie Downer, but it begs the question. So again, our circulatory system, it's our heart, our blood, and our blood vessels. If we got cuts, scrapes, and abrasions, and we're losing blood, that's going to affect our circulatory system. Um, Enlarged left ventricle, heart disease, high cholesterol, cholesterol issues, issues with your blood pressure, an arrhythmia, and or lack of oxygen. So these are the big things that I look for when we're talking about the circulatory system. And if you forgive me for a moment, I'm going to go back to this slide. As a wilderness first responder, if I'm attending to a runner that is injured on the course, these are the main three systems that I'm looking at. I start here. Is the circulatory system operating properly? Is the respiratory system operating properly? Is the nervous system operating properly, or is it affected? These are the questions that I ask first, and I will base the next part of my treatment on what I find to these three systems. Respiratory system. So again, the respiratory system inhales oxygen and exhales carbon dioxide. Organs and other structures of the respiratory system include your nasal passages, your lungs, and a long tube called the trachea, which carries air between the nasal passages and the lungs. The main function of the respiratory system is to deliver oxygen to the blood and remove carbon dioxide from the body. Gases are exchanged between the lungs and blood across the walls of capillaries lining tiny air sacs called alveoli in the lungs. And in this graphic on the right, you can kind of see the alveoli as the inside of your lungs branches out like trees. And the leaves of the trees are your alveoli. And that's where the gases are exchanged between the lungs and blood across the walls of the capillaries therein. Now, what are the common things as ultramarathon, trail and ultramarathon runners that you would experience out there? I think dust and smoke and particulates of any kind are where it kind of begins. So I always tell people, if you get one of those multifunctional neck scarves, also known as a buff, as part of your pre-race giveaways, wear it. Have it on you, put it in your pack, wear it around your wrist. You can wear it like, ladies, you can wear it like a scrunchie around your wrist, put it in your hair. But if you get into an area on a course where there's ATVs or dirt bikes or off-road vehicle traffic that's kicking up dust, don't be stubborn. Cover your mouth, cover your nose. Do not get that dust into your airway, into your respiratory system, because it will cause problems. I like to soak my buffs in water, keeps me cool around my neck, and it also helps to filter the air that I intake. Smoke. Here in the Mountain West, smoke is a big issue. We often talk about particulates in the air from wildfire smoke. Here in Colorado, it's not out of the question that smoke from wildfires in Alberta, Canada, could give us an air quality here in the Denver metro area worse than what you would find in Beijing. Like, we often have the worst air quality on the planet. And some races will outright cancel the race, period, if there's too many particulates in the air, if the smoke is too thick. And that's just something to think about. I mean, I'm not a race director that's going to cancel a race for smoke. I think we're all adults and we can determine if we're going to run or not. And I trust that my runners are going to show up with the gear that is going to help them uh, filter the air to the best of your abilities. Now, little story. I ran in the Tahoe Rim Trail 100 years ago, and the smoke was so bad we couldn't even see Lake Tahoe. And it actually caused an unusual amount of runners in the field to have vomiting issues. We ingested so much smoke on that run that just I think 100% of every runner on that course threw up at some point because your body always goes to this fight or flight response. And so vomiting from that much smoke was a flight response. Our bodies were definitely like, we don't know what you're putting in us. We don't know how to get out. Let's just barf. So that's what happened. Other things to be mindful of are allergies. Be mindful of your allergies, especially to things like pollen, smoke. Maybe my sister is allergic to like mildew or like I don't know how to say it. Like she's allergic to snow or something like that. So she wouldn't do well running in the Pacific Northwest. It's too wet. Um, there's some odd allergies out there. There's also things like poison ivy and poison oak that if it brushes up against your skin, you're going to have a blister situation and a rash and itch, and that's going to affect another system of your body. Um, as I wonder, just a rhetorical question you can answer in the comments if you'd like. Has anybody here ever had poison ivy in your airway? You can breathe in the or maybe you've brushed your hand up against poison ivy and then you start biting your fingers, and next thing you know, you've got poison ivy in your esophagus. It's very dangerous. That could be a huge issue. So being mindful of your allergies and thinking carefully about what you're interacting with out there and how you're going to deal with that. And maybe it's like if you're allergic to bees and you get stung by a bee, do you have an EpiPen in your pack when you run? Um, Kindly, as a race director, I want to make sure that everybody hears that if you are somebody who is allergic to bees, you should absolutely have either an EpiPen or a Benadryl in your pack. If you don't have an EpiPen, they're really cheap. You can get them really cheap from the pharmacy, especially if you have a known allergy. It's always best to run with your EpiPen. And it's not something to risk. Same thing with asthma. If you have asthma, typically you have an inhaler or an albuterol something. Over the last couple of years, we've had a number of runners having an asthma attack at 10,000 feet up in Fairplay, our races here in Colorado. And the first question I ask is, do you use an inhaler? And the answer is always yes. Do you have it on you? No, I don't know where it is. I think it's in my car. I think it's in my tent. I left it at home. If you're planning to run in any trail or ultramarathon running event in the mountains at altitude, you absolutely need to have your inhaler on you. Inhalers also help if you have too much dust or smoke in your airway. Believe it or not, using an inhaler can help you reopen up your airways and kind of clean things out a little bit, and allowing you to get more oxygen back into your body. Okay. You could also have fluid or other material in your lungs. I don't know about some of you out there who have run an ultra. Seems like those of us who have run 50 miles or longer, you may have an interesting cough at the end of the race where you're coughing up a really nasty goop that is brown in color and tastes funky. That's your lungs trying to get the shit out of it. I mean, just the amount of stuff that we can inhale on a dusty course or on a smoky day. And really, I don't think we think about just how much dust particles get up into our airway while we're running. And when we get to next week's class, I'm actually going to share with you a picture of my legs from running in the Wasatch 100. my legs were covered in wildfire soot, and there hadn't been a wildfire where we ran in many years. So just running on those trails, all these runners kicked up all of this soot from wildfires, and if it's on my legs, it's in my lungs. Um, so again, your body is definitely going to try to get rid of those things. So fluid or material in your lungs, that's a common thing for ultra runners. And then the last thing, respiratory system, is altitude. Altitude sickness. It's a big question. I get asked as a race director, what do I do for the altitude? How do I train for the altitude? What's best? Should I really come out 2 weeks in advance? Or should I come out like the day before? Or should I not worry about it? And the answer is yes. That is the answer. What do I mean by that? Well, there's research that's come out very recently, over the last 5 years rather, that talks about altitude sickness or altitude related issues actually being you have a genetic predisposition to these things. So some of us, it doesn't affect us at all. So you don't need to acclimate. We're not talking about Everest. I used to live at sea level and fly out to the Mountain West. And what I would always do is I would fly in as close to race day as humanly possible and run in the race and get however far it is, even if it's a finish, before my body has even had time to figure out that we have changed our air pressure and we have changed our altitude, and I'm out of there and heading home as soon as I'm done. So that always seemed to work for me. I think there's also research out there that has studied that those of us who are affected by altitude, there is a number. Each of us has like a magic number. For me, it's 12,500 feet. I'm good until I get to around 12,500 feet. Above that elevation, above that altitude, my body just immediately is a complete and utter mess. I will get weird explosive diarrhea. I'm no longer want to eat or drink anything. I might get a headache. I might have a stomach ache. Sometimes I'm incredibly hungry, but the thought of putting anything into my mouth makes me feel sick. I get nauseous. But that doesn't happen until I've reached an altitude of 12,500 feet and above. For some folks, that number's lower. For some folks, that number's higher. So when it comes to altitude, what I'm trying to say is we are all an experiment of one. So I'm not going to tell you, yeah, you should totally come out here 2 weeks in advance, take a 2 week vacation, hang out in the mountains, go run and hike every day, send it, and you'll be good to go on race day. Because the reality is 2 weeks really isn't that much time for your body to properly acclimate either. Everybody who's moved to Colorado from a lower elevation place, it typically takes us 8 months for our bodies to adequately acclimate to living in Colorado. So those of us who have moved here from like the East Coast, you live at sea level, we come out to Colorado and we're like, yeah, we're gonna live this epic ultra trail and ultra mecca lifestyle. Totally rad, dude. Like, and then we get out on the trails and it's like, why am I so slow? Why is everybody else just kicking my ass everywhere I go? I'm the last person to the car. I'm the last person to the peak. My pace has slowed like 2 to 3 minutes per mile. I'm like, and we want to quit. Like I should just quit running. I thought living and training in Colorado was going to be rad, but it sucks and my body hates it. Yeah, because your body is still acclimating to living here. And Nikki here, she moved here from Chicago. It says, yeah, it took me at least 6 months, if not more. I know it took me 8 months. And I've seen it countless times with countless runners who have moved here. It takes many, many months for your body to adequately acclimate to being here. So is 2 weeks really going to do that much difference? No, I don't think it is. So just fly in the day before and let's go. Either your body's going to handle it well or it's not. If your body's not going to handle it well, um, I think it's really important to understand how altitude is going to affect you personally and to prepare for that. And it's also important not to be stubborn if the situation gets worse. If you're at altitude and all of a sudden you have a bloody nose, as a medical professional, the solution is always to send you downhill. I have a massive migraine. My head is pounding. I know it's the altitude. The solution, get to lower elevation ASAP and keep going. Um, I'm short of breath, lower elevation. My heart rate's elevated. I'm showing symptoms of HAPE or HACE. You're foaming at the mouth. We got a problem. If you start foaming at the mouth, we're calling a helicopter. Um, in every single instance where you're having an altitude related issue, the answer is not to go higher. The answer is not to stay at altitude. The solution, the treatment is always to get to lower elevation as soon as possible. I want to stop here for a second and see if there's any questions. You could put them in the chat. It's okay if there aren't.
1 hour later.
All right. The nervous system. The nervous system controls all of the other systems of the body. So, such as digestion, cardiac rhythm, and responds to internal and external changes. So, there's a central nervous system and a parenthetic nervous system. And the CNS, the central nervous system, is basically your nerves and everything that goes all throughout your body. Oh, no, I'm sorry. Central nervous system is your brain, your spinal cord, essentially. And then the parenthetic nervous system is everything that reaches out to all the other places in your body. Okay. Now, the entire nervous system controls all of the other systems. No, go back. Why did that happen? Okay. All of the other systems of the body, such as digestion, cardiac rhythm, responds to internal and external changes, such as activating muscles and breathing. It also transmits information to the brain, such as pain and external sensations. This is where your fight or flight response comes from. So, nervous system issues. Obviously, if there's an issue with your nervous system, we're done. We're just done. Your nervous system controls everything. It's also the main, as it says here, it's the main computer that sends the pain and other sensations to your brain. So I want you to think about something like chafe. Let's say you've got the worst thigh chafe of all time between your thighs there, and moving any more forward. Every time you swish your legs back and forth, the thighs just keep rubbing on that chafe. Okay, yeah, that's a ASMR that you don't like, Amy. I can see that. But every time that happens, there's a pain signal that's being sent to your brain, right? So blisters. You could have horrible foot maceration, which is basically like trench foot. And it feels like you got the worst blister of your life in this little crease between the pad beneath your big toe and your second toe. There's like a crease forms there that kind of looks like the Grand Canyon. And it is the most painful damn thing that could happen to your foot besides breaking it. And you swear to God you have the worst blister of your life. But as soon as you get your feet dried out and the wrinkles to go away, there's no blister there. It was just insanely irritated skin. But that irritation is the pain from that irritation is being the signals are sent to your brain through the nervous system, and it could actually distract the rest of your body from being able to function and do the other things that it needs to do. The pain in your foot could be so bad that your nervous system is not sending the signals to your brain about some other issue going on with your body. Okay, if that makes sense. So The most common issues and injuries with our nervous system. The first one is altered mental status. I always go back. Again, we've talked about altered mental status in the circulatory system. We've talked about it in the respiratory system, and we're talking about it again in the nervous system. As a race director, it is incredibly hard to assess a patient, a runner, if you're hurt. Every single one of you come into an aid station with an altered mental status. You are exhausted. You're in the weeds. I have to ascertain, and this is why I always say it's important for a race director to never direct a race or a distance that they haven't run themselves. So if a race director's never run 100 miles, they probably, or at least haven't volunteered at many, many 100-mile aid stations to get a first-person view of all the myriad of things that come in to that aid station with runners with injuries. They really shouldn't be directing a 100-mile race because, again, you are the first responder. So if I show up to an aid station and always, first thing, runner has an altered mental status. Great. Why are they having an altered mental status? Is it not enough sugar, not enough oxygen, or did they hit their head? Or is there pain somewhere else or something going else on their body that is causing this altered mental status? Because their nervous system is sending so many signals to their brain at once that the only thing that they can focus on is that injury or that thing that's hurt or that thing that's broken. So I need to ascertain, I need to figure out what type of altered mental status are we dealing with? Is it normal? And there's no, in the medical field, there's no such thing as normal altered mental status. But as an ultra runner, I could say, all right, is that normal altered mental status, or is it there's a problem altered mental status? Okay. Traumatic brain injury. That's right, Stefan. Hyponatremia can also cause mental issues. That's right. That's why I have it here on this list. Common issues and injuries. I'll get to that one in a second. So altered mental status. What does it look like? So as a wilderness first responder, we use an acronym called AVPU. 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 The A stands for alert. So when I'm looking at mental status, if you're alert, I would write A. They are alert. You can alert as okay, just alert, like you're awake, you're alert, you're good. V is verbal, meaning you're able to talk with me. So if your mental status is you can communicate, you're alert and verbal, as you're AV. But there's a possibility that you're not alert, you can't communicate with me, so you're not verbal, but your body responds to pain. So you would be P on the AVPU scale. P is for pain. And then U is unresponsive. If we're U, we're calling 911 immediately. Doesn't matter if you become responsive in a few minutes. Unresponsiveness is never good. So if you're U, you are completely unresponsive. You are not alert. You are not responsive to verbal communication. You are not responsive to pain. You are just out. Okay, so AVPU, alert, verbal, pain, and unresponsive. That's my scale that I'm looking for to see where you are on the AVPU scale, which is basically my mental status scale for you. And a lot of things can affect mental status, like changes in body temperature. So that would be hypothermia and hyperthermia. Hypo is if you're hypothermia is when you're freezing freaking cold and you're shivering. The worse that gets, you really start to dive quickly on the AVPU scale. And hyperthermia is basically when you are cooking your brain. So you're either freezing your brains or you're cooking your brains. And again, the 98.6 degrees is the happy place. The further downhill you're going from 98.6, the colder you get. That affects your mental status. And cooking your brains also affects mental status. And again, there's a difference between heat stroke and oh shit, I can't think of the other one. My brain's not working right now. Yeah, there it is, Sam. Heat exhaustion. There's heat exhaustion and heat stroke. And a stroke is obviously worse than exhaustion, right? I think we could all figure that out just between the meaning of the words. You're either heat exhausted or you're having a freaking stroke because of the heat or a type of stroke. There's a difference between the two. One is more emergent than the other. Heat stroke, you definitely are going to have a very altered mental status. And heat exhaustion, you're typically going to be alert. You're going to be verbal. You might be barfing. You might be heading towards that heat stroke. And if we can't get you cooled down quick enough, believe it or not, there's also hypo and hypernatremia, which is what hypothermia and hyperthermia is what I was just talking about. Hyponatremia is not enough water. Hypernatremia is too much water. Believe it or not, you can drink too much. You could have so high a salt content in your body that your body is like hanging on to as much water as it possibly can to kind of dilute the amount of salt in your water. Years ago, there was this story about a mom who wanted to win a PS4 for her kids. So she went to the radio station, and the challenge that she had to do is like, whoever drinks the most water in a 2-hour show will win the PS4 for her kids. So this lady drank 6 gallons of water. She drank 6 gallons of water in a 2-hour time period. She won the PS4, and on the drive home, she died. She died because she has swelling on the brain. She ingested way too much water that it actually caused swelling of the brain. And if you have swelling of the brain, you're going to have an altered mental status. So being in balance with all of these things is incredibly important. Body temperature and your liquids, okay? So again, a lot of things affect mental status, changes in body temperature, brain not working due to a lack of oxygen or a lack of food, shock due to injury, shock due to psychological issues. And this is why we always stop and check on someone. When we do our pre-race meetings at HPRS, sometimes on race day, I like to remind everybody, if you see somebody down tying their shoe, stop and ask them how they're doing. Are you okay? And if they say to you, yeah, I'm just tying my shoe, great. Hang out with them for a minute, because you could be down tying your shoe and stand up way too fast and completely pass out. It's okay to offer, do you need a gel? Have you been taking S caps? Do you need any bacon? Like, is there anything I can give you that I have that I can share with you? This is so very important, because you're encouraging the runner in that moment to do a systems check for themselves. Even though they're just tying their shoe, they're going to stop for a minute and be like, oh, do I need some sugar? Do I need some fat? Do I need some water? What do I need? Do I have what I need? Actually, I would love an S cap if you got one to spare. This is why this is important. We are all in this together. As a race director, I'm not running the whole course, checking on every runner throughout the whole day. That's why I'm relying on the runners to help us out with that. And this is why. So it's really important to always stop and check on someone. Don't just run by somebody. Always stop and check. Traumatic brain injury. Did you fall and hit your head? Did you hit your head on a tree? Did you hit your head on a tree branch? Did you hit your head on another runner? Did you fall and hit your head on a rock? Did you hit your head on your trunk this morning while you were quickly trying to get out of there because you're going to be late to the start? It doesn't take much to cause a traumatic brain injury. It could be just the tiniest bump of your head on something actually could do an awful lot of damage. So those are, if you end up hitting your head, or especially you hit your head and you see stars, you should stop running. If you see stars or the lights go out for any period of time while you're on a run, you need to stop. And the reason you need to stop is because the stars and the blackout, even if it's very brief, very short, are signs of a concussion. And we're talking about your brains here. Scrambled eggs are never good inside your head. So we want to make sure that we're being mindful to think about the things that are happening to us while we're out there. Vision issues. There's this race in Virginia called the Hellgate 100K, where every year runners' corneas freeze. Your cornea in your eyeball will actually freeze to the point that you cannot see or your vision is blurred. I think this is an issue with part of our nervous system. You're going to feel that. It's going to hurt. You're not going to be able to blink. It's going to hurt to blink. But if you're having vision issues, typically that's a sign of a nervous system issue. If there's issues with your vision. We went over hypo and hyperthermia. Again, those are body temperature related. And hypo and hypernatremia are fluid related. Again, our nervous system could cause us to have an arrhythmia because, again, the nervous system helps control cardiac rhythm. Your pain response is your nervous system. Again, we've been talking about that. What are you feeling? If you have pain in one place, it can be masking pain in another place. And then there's shock and allergic reactions. If you get stung by a bee, and first you're going to feel it, and you say "ow," and then next thing you know, there's swelling, and like I had friends as a kid. They were allergic to poison sumac. And if they got it on them, their entire face swelled up to the point that they couldn't breathe. And they'd immediately go to the emergency room. It was really scary. But yeah, we got some more questions coming in. That's great. Yeah, if you guys have questions, put them in the chat. So again, if you have, you could go into shock with hypothermia. You can go into shock with hyperthermia. You can go into shock from hypo or hypernatremia. You can go into shock from a traumatic brain injury. You can go into shock as an allergic reaction to a bee sting or some kind of a snake bite, a spider bite, some kind of plant out there. These are all things that can cause you to go into shock. And if you go into shock, that is a very emergent situation. We need to get you to definitive medical care right away. So that's why I've lumped shock and allergic reactions together. It's very important that as things are happening with the nervous system, these are not situations where fix me up, doc, so I can keep running. Like these are all things that need to be taken seriously, and nervous system issues, you should really get to urgent care or an ER as soon as possible. I'm going to go into the questions here. Heat exhaustion. Thank you, Sam. Don't we for a we. I like the name of that. Is the frozen cornea a nervous system thing or a cold thing? I've seen runners with ice in the hair and beards, but never seen or heard of eyeballs freezing. Aaron, I'm going to encourage you to Google eyeballs freezing at Hellgate and see what comes on up. And I think it's a nervous issue because it's going to hurt. And again, that's a pain response. And I don't know about you, but if my eyes freeze open and I can't see, I'm going to freak the fuck out. Like that is going to be a major problem. We're freaking out, Not a good thing. Okay. So again, when something happens, as a wilderness first responder, I'm going to come upon the runner, and with the circulatory system, I'm going to check and see if you're perfused. And what that means is I'm making sure that you're the right color. You have blood flowing to everywhere it needs to be flowing. There's no blood coming out. Your heart is pumping. Your eyes are dilated. You're correctly. Your brain is working. Respiratory system. We're talking about oxygen. Are you breathing properly? Are you wheezing? Do you have rales? Is there funky sounds coming out of your lungs? Do you have too much fluid or particulates in there? Is your brain working? Nervous system. Is your brain working? I've said, is your brain working on all three of these? Really important. I'm always checking first to see if your brain is working properly. When we talk about the nervous system, we're checking in on the level of mental status that you have. Are we good? Or is there something else going on that we need to look at? That's a good suggestion, Aaron. Let me back up. Aaron just said we might want to explain what shock is. So, shock is a life-threatening condition. Shock is what occurs when the body does not have enough blood flow to meet its needs. It could lead to tissue damage and it can lead to organ failure. And shock can be caused by a number of things like blood loss, low blood volume, so dehydration, heart failure, allergic reactions, an infection like a UTI, burns like a sunburn, or even chafe is considered a burn. And you could go into shock from chafe, absolutely. But shock, the symptoms of shock vary greatly depending on the underlying cause. But typically it's low blood pressure, your rapid heart rate, rapid breathing, cold, clammy skin, confusion, dizziness, fatigue, anxiety. And it's a medical emergency that requires immediate treatment. And treatment usually involves an IV. Sound familiar? Uh, Medications to improve your blood flow, oxygen, um, and depending on what's going on, it might require surgery. So that's shock. It's a very serious thing. I hope I'm not scaring anybody. But let's get into some of these there are other systems. Again, the digestive system. I just told you at the beginning of our clinic here tonight that trail and ultra marathon running is an eating and drinking competition. You just so happen to be running during it. So your digestive system breaks down food and liquids into nutrients and removes waste. It includes your mouth, your oral cavity, your esophagus, your liver, your stomach, your small intestine, your large intestine, your rectum, and your butt. And I want to ask a question again. Is it really a good idea to drink, to chug beers or have liquor shots during an ultra marathon?
No.
No.
Alcohol and I know caffeine is useful, but both caffeine and alcohol lead to dehydration, which, um, if you're already not taking in enough water, that is going to exacerbate the issue even further. And also, I'm surprised someone in the chat mentioned, I thought I saw them mention shots at Last Call 50s.
Oh, yes. You could buy a commemorative shot of whiskey and have that shot of whiskey prior to the start of the race. So on the start line at 11:50 p.m., you could have a shot of some of the worst whiskey in Colorado we could possibly find. And it's a shot before you take off on the run. Now, Aaron, you also said in the chat that you've been to races where there's full bars at the aid stations.
Yeah,
That's
not cool. That's now that I know more about the management side and what John does as a race director, that just strikes me as a risk management nightmare.
right.
Um, before we go any further, and if you don't mind, John, I want to go into a little bit more about shock and how exactly you recognize that. You mentioned it a little when you talked about perfusion. Um, when I took, granted, I don't have my EMT license anymore, but the mnemonic or the signs we talked about in EMT class was pale, cool, and diaphoretic. And so the reasons you want to look for that Um, those are signs that the body is compensating for a lack of blood flow to something else. So when you go into shock, when you don't have enough blood flow for everything, basically your blood vessels, specifically the arteries, are able to expand and contract. And that's how the body directs blood flow to different areas. And so one of the things the body will do when you go into shock is it will pull blood away from unnecessary areas like the skin to preserve the vital organs. And so because of that response, you will see um, a person be very pale and cool to the touch. And also, you may notice a weaker pulse in the extremities, like the hands or the feet. Um, Sometimes they will also be sweaty, which doesn't really make sense. Why would the body sweat when it's trying to conserve water? And that is mainly coming from an activation of the sympathetic nervous system, the body going to panic. But the point of all that is, and I want to hit on this, John, is if you see someone and they're very pale and they're sweaty, which they might be sweaty anyways in a hot race. If they're not, that's indicative of heat stroke, which is another problem. But if they're pale and very cool, that's a not so subtle sign that you need to look deeper. There's probably something more serious going on. And I just wanted to hit on that real quick. I don't mean to take over, but I thought that was important to hit on because that is something to look for, or that you will actually see if you're on the trail and you come on someone that's having medical issues or otherwise. You just have to check on them.
So just to thank you, Aaron, for all of that. So Aaron, I know that Aaron was a paramedic. You're not a paramedic.
I was never a paramedic.
Oh, I never got that far.
I was a volunteer firefighter once, and as part of that, I did go to EMT school. I've since let it go. Didn't renew
Sure.
my certification.
Well, that was all absolutely right. And to answer your question, I was going to say if they look white as a ghost, I would say if they're white as a ghost, and it could be either way, they're hyperventilating, or I'm having a hard time like finding a pulse, right? So there could be one or the other or both. But they're cool, clammy to the touch. They might be sweating to your point. Yeah, those are all signs and symptoms of shock. And also if somebody's having heat stroke, the only difference is that they're cooked. So they would be in shock, a type of shock, but they're warm to the touch, right? Because they're cooking themselves. So all of that you just said is 100% right, and absolutely how we would identify shock. And you're right, we should touch on that a little bit, especially as I said, if you're running down a course and you see a runner down tying their shoe, check in on them. And that is because you get a lot of information just by looking at somebody. Now, if you run it, somebody's tying their shoe and you notice that they get up and they're dizzy and they seem to not be totally with it. They looked white as a ghost. Something seems off. I would expect that you, the runner, would then go to the next aid station and tell the staff there, hey, there's a runner back there who wasn't doing so good. Here's what I witnessed. You're giving us enough information that we can immediately go out and check on that runner, or we can wait for them to come into the aid station and check on them if and when they make it there. And we'll know how to treat them. We know what's coming down the trail at us, so we can get ready to figure out what we can do for them. And I would say also, to your point, Aaron, I see a tremendous number of runners in a state of shock. I wouldn't call it like full on shock at our races, but a state of shock, or they're heading down that road if we don't figure out what's going on right now that's causing these symptoms that they have. And normally it's, let's sit down in the aid station. Let's get something to eat and drink. I know
And
go ahead, Aaron.
I would say a runner might not realize that they're in shock or that they're that dehydrated.
Right.
Because I brought up earlier that when I had to have that IV, that was after the Arkansas Traveler, my first ever 100. I didn't think I was that dehydrated, but I crossed the finish line. I sat down and like, no, you need an IV, and they took me over to the IV station. And even though I thought I was just really exhausted, but they're like, no, you need an IV. So the runner themselves may or may not be aware. And
Well, you know,
I think that's why, you say the race director or the aid station captains have the authority to pull someone from the race at your discretion.
correct. Yes. And typically I make that decision based on health and safety issues. So if I recognize something's going on with you, and if you have no idea what shock is, you and I are going to start having an argument about if you're okay or not. And it's one of those, well, I've got some medical training. I know what I'm looking at. I know what I'm seeing. We're not going to fix this here. I think we're done today. I also think that if you go to the hospital for anything, don't do the David Goggins and go back to the course and finish the 240-mile run that you're on. If you've gone to the hospital to get treatment, the best course of action you can do after that is go get some rest. Always. Also, we kind of have this joke at HPRS. We hand out these stickers. No one cares about your Strava. And I'm showing it here because I give this out not just because it's an ego-averse thing. There are so many runners that are having a medical issue during a race who demand that they be able to continue no matter what. And it's because they don't want a DNF to show up on their Strava. Or they might stop their watch so that nobody can see that spike in downtime at an aid station for 3 hours while they're getting treatment. Your Strava is not the most important thing in the world. Your health and safety is, and the future preservation of our events. Thank you again, Aaron. I appreciate you chiming in on that. Let's get back to the digestive system. So common issues and injuries with your digestive system include UTI, urinary tract infection. I don't know if you kids know this or not, but if you go pee-pee in the woods and then you don't adequately clean yourself after going pee-pee in the woods, you could easily get a UTI. You could also show up to a race with a UTI and not necessarily know that you have one. Yeah, E. coli, that's another one as well. Whoever Run Hike Beer is, email me and I'll mail you another sticker, or come to a race and I'll give you one. So a UTI can actually lead to rhabdomyolysis, which we'll get to here in a little bit. So if you show up to a race with a UTI, should you really be starting the race? That's a decision that you're going to make. And most people would think that a UTI is not that big a deal, but it can turn into a very big deal in a very short amount of time. Constipation. I've seen a number of runners taking Imodium during a race. You don't need Imodium. You need more fiber, kids. If you've got diarrhea, chances are you either have a low fiber diet or you're sick. And taking Imodium actually could cause you to be constipated throughout the event. And that's not a good thing either. Obviously, we could be vomiting, have an upset stomach. We could be nauseous. We've talked about lube chips at our events, again, which is when somebody puts lube on their hand and then wipes it wherever they're going to wipe it. And then they grab potato chips with the same hand without washing their hands. And you folks, like you would think that shit doesn't happen, but COVID has taught us nothing. It happens all the time. It's really gross. I've seen some of the nastiest fucking runners in my life put their disgusting hands into the M&Ms And now everybody gets to eat their sweat and whatever else, their lube out of the M&M bowl. I mean, come on, really? That's why we put scoops out at our aid station tables so we can serve you, or there's tongs so we can give you fruit and put it in your hand so you're not reaching your nasty mitts into the food. Pretty much every race, I am accused of giving somebody food poisoning. Every single race, we are accused of giving people food poisoning. After every race, I disinfect and scrub every single water jug. I try my best to scrub and clean the coolers at regular intervals. We clean the stoves. It's no use. I hand wash all of our pots and pans, every knife, every tong, every spatula, every scoop. It's the worst part of my job. It's the number one thing that I absolutely hate doing in the world is race dishes. And I have to do them. And you should know that races do not fall under health code. We don't have to get a food license to set up aid stations at our events. It depends where you are. Some places in Texas do require the race director to get a food license for serving aid station foods. But for the most part, 104 races that I've directed, I've never once had to get a food health and safety license or certificate to provide aid station foods. And when you're doing a race every single month, yeah, things get dirty. I do my best to follow good healthy food safety protocols, making sure we've got things on ice, making sure that all our aid stations have latex gloves so that our volunteers have some level of protection before they're cutting things up or serving you. But I can't be at every aid station, and I can't watch every volunteer, and I can't make sure everybody's using hand sanitizer every time they do something. And yeah, sometimes our griddle is disgusting and the stove is pretty disgusting. And it's not perfect. And so there is a possibility that you could get a foodborne illness at an ultramarathon. And I've gotten to the point in my career where I bring all of my own food to every race. And the only things I take from an aid station are fruit and water. And I encourage runners to do the same, especially if you're a vegetarian, vegan, gluten intolerant person. Bring your own foods. It's going to keep you a lot safer and a lot healthier anyway, and you're going to have exactly what you want on the run. So I put that out there. So UTIs can lead to rhabdo. Constipation can lead to dehydration. And Imodium can cause constipation. So if you're taking Imodium, you're going to get constipated. It's going to lead to dehydration. Vomiting. Sometimes it's a necessity. There have been times in races where things aren't working and I just want to barf. Don't fight it. 2 fingers, throw it in there, get it out, start over. Nobody's going to judge you. In fact, there's probably going to be somebody there cheering you on, telling you, all right, get that shit out. Start over. Let's go. Yeah. People love to watch people barf for some reason, and some people don't. I'll also be mindful that stomach acid can cause damage to your esophagus. If you don't have enough food or liquids, you're not feeding the machine. Your body is a machine. So make sure you're eating and drinking enough. You could have a throat blockage. So that would be, maybe there's too much feeding the machine. Maybe you've put way too many food items down your gullet and it's just chilling. For me, when I used to race with tailwind, there was a huge debate in the sport. And the debate was, a lot of folks used to say that when I use tailwind, my body doesn't digest fruit with thick rind like it normally does. So if I ate oranges or watermelon while during a race and I was drinking tailwind, there was an ingredient in the tailwind that would prevent my body from digesting the oranges and watermelon. So next thing you know, I've got oranges and watermelon stacking up in my esophagus to the point that the only thing I could do was barf and start over. Well, come to find out, after some research, it was true. And the debate was really an argument with Tailwind telling everybody that's not true, that's not a thing, only for them to then say, oh, no, actually, that is a thing, and we got to change our recipe. There are other drinks out there like Noon and Heed. Some of us used to call it Heave because it has sorbitol in it. And your body, for some of us, our body immediately bloats due to sorbitol. So if I drink Noon, I immediately have a huge air pocket in my stomach. That's not going to work for digestion. So there are certain drinks that I need to stay away from that I don't use. And Stefan here, who's a registered dietitian, says sorbitol can make you gassy. It's in a lot of bars too. Okay. Oh, your body, believe it or not, your body can only absorb 240 calories an hour. And I think that's on average, like for the average person. And if it's more, it's not much more. 240 calories per hour. Think about how many calories you're actually burning during the run. And there's a huge mismatch there. You cannot possibly ingest and absorb enough calories to replace the number of calories that you're burning. So that's why it's incredibly important that whatever foods you're putting into your body during a race are the right foods. Make it the right calories. I go back to that question. Should you be chugging beer during, should you be getting your shit drunk during a 100-mile race? Absolutely not. There's going to be a lot of it. Yeah, I want the carbs. Is that the right kind of carbs? Is that really the carbs that your body needs to do what you're asking it to do? Is there a different way you can get carbs into your body that's healthier, that's not going to affect other systems in your body by getting yourself drunk or buzzed? Important question. So your body can only absorb 240 calories per hour. Make sure it's the right calories. You could also have a lack of digestive enzymes. So runners who have digestive issues and lack sufficient digestive enzymes may experience bloating, gas, belching, delayed gastric emptying, abdominal pain, increased stool transit time. I like how that was worded. Increased stool transit time. In other words, you're going to have explosive diarrhea. Constipation, you could have fatty stools, you could have food intolerances, and fatigue. So keep track of your number ones and twos and pay attention to them. Hugely important. I've met some runners that don't like to poop in the woods. And in my pre-race manual or my email, it says, if you can't do your ones and twos in the woods, you're in the wrong sport. Why is that important? Well, you actually should not only shit in the woods, but look at your shit and see what color it is. What is the consistency of it? Is it, did I just have, is there blood in my stool? Did I just have explosive diarrhea? Is it way too hard? Is it black? Is it green because you ate Monsters Inc. ice cream the night before? Whatever it is, like your stool can tell you an awful lot of information about what's going on with the inside of your body. So it's incredibly important that during a race, you do your ones and twos. Don't hold it. Don't wait. I'll do it when I'm done. I'll do it tomorrow. Like, no, do it. You've got some information. That is basically your body giving you a slip. Hey, here's what's going on. Check this out. Check it out. It's not about being a sick person or being gross or whatever. There's important information there. The endocrine system comprises other glands, including the pituitary, thyroid, adrenals, and the pancreas. The pancreas is the one in this picture on the right that looks like a corn on the cob. It's a lump with knobs. The hormones that regulate most body functions, from growth and metabolism to digestion and reproduction. I keep using the word reproduction. You're going to ask, what the hell does reproduction have to do with running? I will get there. I promise you there's issues there too. So your adrenals regulate your metabolism, your immune system, blood pressure, response to stress, and other essential functions. Okay. Your pancreas Regulates your blood sugar. So if you have low blood sugar, which is typical, that could lead to an altered mental status. So if your pancreas is not working properly, if your pancreas is not regulating your sugar properly, it can and will affect your mental status. Your thyroid controls energy usage. It regulates your body temp, regulates your heart rate. Are you somebody that has thyroid issues? Are you on thyroid medication? Your thyroid medication is going to affect your body's ability to regulate its body temp. Not being on your thyroid medication is going to affect your body's ability to regulate its body temp. Same thing with your heart rate. You could have heart rate issues if you're not taking your thyroid meds or if your thyroid's just out of whack during the race. But I think the bigger thing is your thyroid controls where the energy from the food that you're eating, the food and drink that you're eating, your thyroid kind of helps send the signals of where it's all going to go. Muscles, heart, brain, blood, whatever, it's going to help. Your pituitary gland manages energy from food as well. What does it do with it and where does it go? And it also controls kidney function. So this is where I want to talk about rhabdomyolysis. Rhabdo is a serious medical condition where muscle tissue breaks down rapidly, releasing harmful substances into the bloodstream. And this can lead to organ damage, particularly to the kidneys. Now, causes of rhabdo could be trauma, like if you had an accident or you fell, a crush injury, like if you broke a bone. You could have prolonged muscle exertion, strenuous exercise, specifically marathon and ultramarathon running. Heat stroke can lead to rhabdo. Certain medications like statins and corticosteroids, infections like a UTI, and metabolic disorders. All of these things can lead to rhabdo. And what are the symptoms of rhabdo? Severe muscle pain and weakness. Dark or red urine. If your urine looks like a Guinness, you have rhabdo. Muscle swelling, nausea and vomiting, confusion or altered mental status, irregular heartbeat. And the treatment for rhabdo is get to urgent care. You're first going to be on an IV. In severe cases, you could end up on dialysis. The sooner you catch it and the sooner you treat it, the better it's going to be for you. Okay. Again, hyponatremia, which is too little water, and hypernatremia, which is too much water, is a common issue. We got high or low blood pressure and stress response. Musculoskeletal. This is the one that I get to say one of my favorite things. You are just a bag of meat hanging on some bones, and you so happen to have an electrical charge that nobody has any earthly explanation for how it even got there. The electrical charge. No idea where that came from. But hey, you got a charge of electricity and it got everything moving. Congratulations. You are just a bag of meat, a sack of meat and skin and nastiness hanging on this skeletal structure. It keeps you upright, supports your body's weight, protects your internal organs, and allows for movement. I think everybody knows what a broken bone looks and feels like. You have experienced a sprain or a strain in your life, all of you, I'm sure of it. Ligament tears, muscle issues. I'm not going to dive too deeply into this. I think it's pretty self-explanatory. This image just above me here, I just wanted to show you. Next time you eat a steak, cut that steak open and like study it real close. Because it's the same makeup as your muscles. It's all it is. Steak is a muscle from an animal. And it's made the same way. It's like stacks of sarcomeres or like meat stacked up ever like closely together. But I wanted to show you that your muscles attach to all of your bones via ligaments. Everything is attached. So I'm not going to give you an anatomy and physiology lesson here. That was a hellacious class. I don't recommend. You learn a lot in it though. The big thing I want to talk about is fatigue. And in trail and ultra running, maybe you've seen a runner that has what we call the leans. And it's when a runner is typically towards the end of an ultra, but it could be in shorter distances. And that runner is like coming into the finish line or an aid station, and they look like this. And you tell them, hey, you're leaning. And in most cases, they have no idea. They have no clue that they're leaning. We used to think that that was an electrolyte imbalance. And we've learned that that is just a small part of it. Typically what it is you have a weak ass core. You have not done enough of the exercises to help this area of your body. And essentially you're collapsing in on itself. Your body is like collapsing. You've got the leans. Also, maybe you're somebody that on the meat of your calf, like down by just below your knee, on the media, or just below your calves, on the inside of your leg, just below your calves on the inside of your leg. And I can actually point this out. So maybe like you kick yourself in here, your heels, when you run, you will kick yourself right there in that place. And if you're one of those people, so your heel is basically kicking you right there. You have a weak ass. I don't know how else to say it. You have weak glute muscles, and it's causing your leg to swing inward, and you're clipping the inside of your, I guess, like the side of your shin, for lack of a better term. You're clipping that with the heel of your shoe, and you're causing this abrasion to form there. Maybe when you're running, you look down, you always have like a scuff of mud there. It's because you've got weak glute muscles. The reproductive system, I told you we would get here. We all know what the reproductive system does. For the ladies, I will say that trail running and ultramarathon running, a strenuous exercise, could cause you to have an unexpected cycle. It could also cause you to have cramping that mirrors your cycle. If you are pregnant and you're out running, you could instigate a miscarriage. I'm going to leave it there. If I am not a lady, I have not studied ladies' health in depth or detail. And I welcome you to please reach out to proper individuals who can help guide you if you are having those issues, or if you would like to talk about those issues. There are people well more equipped to have that conversation than I, and I don't want to offend anybody. So I'll just leave it at that. You could have an unexpected cycle. You could have cycle-like cramping, and you could have a miscarriage if you're pregnant. You could also have pelvic floor dysfunction. If you're a male out there running, we don't talk about this at all, men. Men, we don't talk about this at all. We're going to talk about it right now. While you're out on a run, you may have stopped in the woods to urinate, and when you drop your drawers to take them out, you may notice a bit of pre-ejaculate or pre-cum coming out of Mr. Winky. And that is actually a sign of a weak pelvic floor. As men, we don't do Kegels. It's not taught to us. I call them Magels. The male version of Kegels are Magels. You can do Magels. There are Kegel exercises that men can do that will help strengthen your pelvic floor and could take care of that issue. Also, you could have a swollen prostate, which also leads to that same thing, a little bit of pre-ejaculate coming out of you. So these are things that males could experience on a run, and it is frequent, and we never talk about it. And I think it's because we don't have permission to talk about it. So I'm giving you permission for us to talk about it. It's important. You could also have a lower testosterone level because of your excessive exercising, and you could lower your sperm count. There's also things like testicular torsion. There is something else I was reading that was like something to do with your body's electrical charge can affect your testicles because you run. I didn't dive too far into that one because I didn't think that was common. I thought that was a pretty rare thing, but there are things that can happen to the dudes out there too that are not that pleasant. Just leave it at that. The integumentary system. This is your skin, essentially. It protects the body, keeps all your shit inside. It's that, again, that's what keeps all that sack hanging on the bones together. Your skin is your largest organ. It regulates your body temperature and it eliminates waste. Organs of the integumentary system include the skin, hair, and nails. The skin is the largest organ in the body. It encloses and protects the body and is the site of many sensory receptors. All your nerve endings end at the skin. It's the first line of defense against pathogens, and it's also, again, help regulates body temperature and eliminates waste in your sweat. I used to shave my arms for ultra marathons, mostly so that I could see that I was sweating. It's fucking weird. I can't explain it. I'm just admitting it to y'all. I used to shave my arm hair off so that I could easily look down and see if I was actively sweating. And I always thought that if I was actively sweating, then my body is doing its job. Because I know that by running in these races, I am producing waste within my body. And the main ways that my body gets rid of that waste is my number ones and number twos and sweating. So if I am charged with keeping track of my number ones and my number twos and paying attention to the color of my urine and paying attention to what's going on with my stool, I also should be paying attention to my sweat rate. Some people sweat profusely. Also, you might be somebody that during a race, you get this salt ring around your neck. You get like a salt necklace, and then you get your salt bra. And then you got your sweat ring around your belly button, and then you got it down on your shorts. And when all of that happens, what is that telling you? It's telling you that your body is pissing out a whole lot of salt. So you kind of need to replace that salt because you need salt for muscle contraction. That's part of that system. So if you're losing that much salt, you got to put some salt back in. I'm not saying you got to put all that salt back in, but you got to put some of it back in. So your sweat can tell you a great deal about what's going on with your body. And if there's no sweat, that also tells you something that's going on with your body. If you're not sweating while you're exercising, even if you're in the desert, kids, you're not properly hydrated. The most common issues with this system of your body are rash, chafe, and sloughing. What the hell is sloughing? Sloughing is something that happens primarily in your training cycle. You might be somebody where after 2.5 months in your training cycle, you notice that the skin on the bottom of your feet starts falling off. I mean, it's just peeling off like randomly, like your body is replacing the skin on your feet. There's a sloughing off thing that happens. It's actually normal. And that's exactly what's happening. Your body is replacing the skin on your feet that you have damaged beyond its usefulness. Your body is saying, okay, this wrapping paper we've put on this gift is no longer properly covering the gift. So we're going to get rid of this and rewrap it. Rash and chafing. I have had chafe in my backside bad enough that I started to bleed down my leg. If you're bleeding, that's not good. How do you treat blood in your butt crack? Does that sound pleasant to you? Does that sound like something you can keep clean? It does not. And this is why it's so very important that we find a lubricating product that helps us prevent chafe. and helps us tackle it. Maybe it's, I used to be a landscaper in a very hot and humid environment. I wore pantyhose all summer because it was like the only thing that prevented chafe. Then I got into compression shorts. Some people claim that shaving all of the areas helps with chafe, and some people claim that shaving all of those areas actually makes the chafe worse. You've got to figure out what works for you and what works for your body. But definitely you want to take care of chafe before it becomes a big problem. I always lubricate the side underneath my armpit. I don't put Band-Aids on my nipples. I put lube across my nipples. And then anything else, any other place that I know I'm going to have chafe or some issues, I will put lubricant on it as a preventative thing. Sunburn. If you burn your skin and you cooked your skin, your body is going to do everything that it can to treat that burn. If your body is putting resources towards treating a sunburn, it can't put those same resources towards you running that race. So making sure that you are applying sunscreen and reapplying sunscreen throughout the event is actually really important. Same thing in cold environments. Frostbite, and by the way, there's a difference between frostbite and frost nip. Frost nip is like, so when it gets really cold outside, your hands, I'll use this as an example, your hands will turn red and they get redder and redder and redder until all of a sudden they start turning white. That is frost nip. If we go past white to black, so now your fingers are turning black, that's a type of necrosis. That is frostbite. I've had frostbite on this cheek before from recreating in the mountains in winter, and I will never not feel this area when it gets cold outside. It causes nerve damage. Anytime it gets really cold out, this area of my cheek where I've had frostbite before always hurts. It stings. It feels like a sunburn. So if you get frostbite, you'll always feel it after getting it once. So cover up. Know the difference between frostbite and frost nip. And Raynaud's. Raynaud's is something completely different. A lot of people don't know they have it, but that's basically if your hands get cold, before you even get to frost nip, your hands are in so much incredible pain from the cold that you can't even use them. That's called Raynaud's. You can get it in your fingertips. You can get it in your toes. And public service announcement, please stop wearing shorts when it's under 40 degrees. Just stop it. Seriously, stop it. If it's under 40 degrees, I don't know what the deal is or what you're trying to prove. You're not cute. I get it. You don't want to wear the tights because you don't want the world to see your bulge. Wear a pair of shorts over the tights, guys. But stop showing up to the race in your short shorts when it's 30 degrees outside. I just think you look like a dumbass. I really don't. That's it. I mean, you're just setting yourself up to be somebody that I need to treat later. So that's why you've annoyed me. It's like one of those you're the guy I'm going to have to respond to because you're not doing yourself any favors by covering up and helping your body regulate your body temp. So please stop wearing the shorts when it's under 40. Cut, scrapes, and abrasions to your skin. Again, seek medical right away. In races, an awful lot, a runner will get a cut on their leg, and by the time I see them, the blood is completely dried. Cool, the bleeding has stopped. However, what you've also possibly done is all the rock, dirt, grit, pebbles, whatever other shit is inside that cut is now trapped in there. So when you finally do go to clean that cut out, it's going to hurt a hell of a lot worse because now you really got to scrub to get it clean. Whereas if you get treated after the cut first happens, we can prevent some of that and we can stave off infection. We can do the things necessary to clean the wound, get it covered, allow your body to do what it needs to do to get the bleeding to stop, get itself to regular homeostasis. And that way your body's not solely focused on this never-ending bleeding that's going on. So if you get a cut, a scrape, or an abrasion during a race, if you can get treatment quickly and get it cleaned before it dries up, please do. We've talked about allergic reactions, blisters. Keep your shit clean, friends. Clothing that fits and shoe that fits. Make sure your shoes fit. A blister. Every blister forms with just a single like little morsel or little bit of dirt on your skin, and it gets wet. Done. That's all you need. Dirt and water. And the cycle starts. We're going to get into blisters more in the next class when we're talking about fixing our feet. That's when they tend to happen the most. For now, I just want to say, make it regular that you are changing your socks and shoes during a race, even if you never went through a water crossing. So if you're just out running in a race and it's in a really dusty area, you're sweating. So you don't need to go through a river crossing for your feet to become wet. Your natural sweat and your heat loss through your feet can give enough moisture to the dirt within your socks that you're going to cause some blisters. So regular sock and shoe changes, or at least just a sock change during races. Plan those, even if there's no river crossings. Black toenails. I've seen some really nasty feet. Holy shit. Oh,
Bruh.
really gross. I've seen some the worst. The worst. Some of you have a really unfortunate problem, and it's that your second toe sticks out further than your big toe. And you are the people who are screwed. And it's really because if you look at the shape of a regular shoe, they're all shaped in a way that it doesn't account for that. Shoes like Ultras and Hokas that have that wide toe box, Topo Athletic, there's some other brands out there. That wider toe box can actually help you. So I'd look into those. But really, the main key is to trim your toenails as short as you possibly can. Ladies, I know you love to paint your nails. You love to paint those toenails. I even love to paint my toenails. I enjoy it like way more than I care to admit, but I'm going to admit it. I love painting my toenails. It's fun. But if you cut your toenails super short, there's often not enough toenail left to go and get a pedicure, right? So I don't know. Sometimes painting your toenails can hide that black toenail pretty good. But the key is to cut your toenails as short as possible so they're not getting snagged on your socks. And same thing, if your toenail is longer than your toe and that nail continues to bang on the front of your shoe, naturally you're going to lose the toenail. You're causing trauma to the toenail. So the shorter you can cut your toenails, the better that's going to be for your feet and your toenails. There's calluses. And then there's pain to your skin. Nerve ends are affected if something happens to your skin. And again, really bad chafe, losing your toenail, a blister, foot maceration, anything that's going on with your skin can be so painful because it's touching the very ends of your nerves that it can mask other things going on with your body. I have like 2 more slides. So the lymphatic systems, this maintains fluid levels, removes harmful substances, and absorbs fats. I've always described the lymphatic system as like the waste superhighway within your body. Your lymphatic system is going to take all of the waste, all of the horrible things going on in your body, the breakdown in proteins and muscles, and it's what helps carry things to your kidneys to be filtered. So it really does. It helps maintain your fluid levels and absorbs fats. And if you're somebody who is on a keto diet, and you rely on fat for fueling, your lymphatic system's pretty important for this. I want to talk to you specifically about lymphedema. Is Nikki still here? Or did Nikki bail? Let me look. Nikki said she might bail. She did. Okay. Lymphedema is a chronic condition that causes swelling in the body's tissues, typically in the arms or legs. It occurs when the lymphatic system, which is responsible for draining excess fluid from tissues, does not function properly. So this looks like a red-looking itchy rash around your ankles. So those of you who have run 50 miles or longer, you've had this. You take your socks off, your ankles are swollen, they're super red, they're itchy, and that redness can travel as high up as your knee. And that's essentially lymphedema. And it can get so bad. Next class, I'm going to show you a picture of Nikki's legs, that she actually was oozing. Like her body was like leaking serum at the finish line of a race, as if she had like the worst sunburn ever. And the blisters from the sunburn were oozing, except she didn't have a sunburn and she didn't have blisters. She was just oozing. She had lymphedema so bad, her body didn't know how to transport all the garbage to where it needed to go. That it just started to be like, like we're just going to let it go right here. Like it's going to come out here. It's really fucking gross and it's really scary. So the lymphatic system helps runners by removing waste, reducing inflammation, and supporting the immune system. Exercise like running can help stimulate the lymphatic system and improve its function. So the big things here are dehydration and overhydration. Again, can have harmful effects on your lymphatic system. And so I'm getting to the crux here. I know we've gone longer than I thought we would, and I apologize. I hope you folks are enjoying this. Everything is connected. If something happens to you, it starts with one system, but it always affects another system. Something that affects your circulatory system can affect your respiratory system. Something that happens with your respiratory system can affect your circulatory system, can affect your nervous system, your lymphatic, like all of these systems are working in unison. So I just want to ask the question, what happens when the check engine light comes on in your car? Most of you say, I keep driving. And then what? It always gets worse. If the check engine light comes on and the first thing you do is take it to the mechanic and the mechanic looks at it, 9.5 times out of 10, that mechanic is going to say to you, it's a really good thing you brought it in. It's a good thing we caught this now because it could have been a lot worse. The same thing is true for your body. If you feel something, if you feel pain, if you feel nauseous, if you feel like your brain's not totally there, you're not breathing right, your breathing doesn't sound right, you're bleeding, these are all check engine lights. Blood is a check engine light. Blood in your urine is a check engine light. Fluid in your lungs or a raspiness or like you're trying to cough up stuff from within your lungs is a check engine light. You're dizzy, you're nauseous, check engine light. You got a barf, check engine light. You feel, somebody says you're white as a ghost and you feel cool and clammy, a check engine light. Every single time you should stop. Even if it's just, look, get to the next aid station, sit down and do a systems check. And again, the systems you're all checking are all of the systems that we've just gone through, all 9 of them. Circulatory, respiratory, nervous. These are the 3 biggest ones. Then you're going down through these other ones. The digestive, lymphatic, musculoskeletal, endocrine, everything. People have often asked me in my time as a runner, what do you think about when you're out running? Like, are you like listening to the birds? Are you looking for shapes in the clouds? Like, what is it that you're thinking about while you're out running? The answer should be, I am constantly doing a systems check. I am checking myself to see how my brain is working, how my breathing is working, how my heart is pumping. I am constantly checking on my sweat. I'm checking out where I might have chafe or a hot spot where a blister might form on my foot. I am constantly doing a systems check. That is what I'm thinking about. I am constantly thinking about, what do I need to do to keep my car going? What do I need to do to make sure the engine light does not come on? And if it's come on, what do I need to do to get it to come off? As volunteers at races, working the aid station, you're not just cutting up fruit, making foods, and serving runners. Like, if you've been in this sport long enough, you're there to help dispense knowledge to problem solve the check engine light for all of these runners. And I'll also say it's important to have regular oil changes in your vehicle as well, every so many thousand miles. And what is an oil change for a runner? It's called rest. The 0 day. I'm really good at that right now. I've got lots of 0 days. You can't you can't be well trained if you're constantly tapering. I'm always tapering. Rest days are your oil change. I also wanted to hit briefly on chronic fatigue syndrome. It's a neurological condition that affects multiple systems in the body. Chronic fatigue is typically, I've seen it present mostly in the elite athletes. Jeff Rose, some of you might recall the name Jeff Rose, Nick Clark, Anton Krupicka, and there are countless others of runners in the ultramarathon landscape for many years who performed at an incredibly high level, only for them to like disappear. Where did they go? Why aren't they competing anymore? Well, they have chronic fatigue syndrome. They did not take care of their bodies. They bought a car that had 100,000 miles on it. And then they said, watch this. I'm going to put 300,000 miles on this car as fast as I can with as few oil changes as I could possibly do for this car. And what would happen to that car? And if you bought a car like that and did that, the car would explode. The engine would seize. The car is not going to work anymore. It's the same thing for the human body. So I would say to all of you, FOMO is a thing, which is fear of missing out. And instead of, you don't need to run in every race. You can go to a race and volunteer. You can participate in a way that doesn't include you destroying yourself every time. You can just show up and be present. You can be a human being and not always a human doing. And that's more than okay. But getting into this trap of, I have to run this 100 right now. I have to run 300s this year. I have to do the Grand Slam of 200s. I have to run a marathon every week for the entire. No, you don't. And if you think that people are going to be impressed by these accomplishments, I will tell you that they are for 5 seconds. For 5 seconds of your life, people will be impressed. And then they're going to move on to their shit. So this idea that you need to do these things to keep up appearances, that you need to do these things to belong, you need to do these things to be accepted in the world of trail and ultra running, you actually don't. What you need to do is be smart, be healthy. I think it's a better story if you ran ultras for 10 years and never got injured. And at the end of 10 years, we were like, how did you do it? And you just said, I took care of every check engine light and changed my oil. That's what I did. I will now answer any questions, if there are any. And if anybody just wants to chat for a little bit, I'm open to that as well. That's what I had for class 1. I know it's a lot. It's been recorded. You can watch it whenever you want, however many times that you want. You can watch half now, half later. You can watch it in thirds, whatever you like to do. This is the first time I've given a clinic like this. I hope you enjoyed it. I hope it was informative. I don't know how I did. I guess I'm looking for feedback a little bit too. So Our next class will be Tuesday the 18th. Same bat time, same bat station. That's 7 p.m. Mountain Time. Bleeding but not dead. I'm going to share with you all the injuries that I've seen at HPRS. And again, I have pictures, and we're going to talk about exactly how I treated them. And hoping that that helps you as well. And we're going to get into fixing your feet as well. Thank you, thank you, thank you. Thank you, everybody. If you're leaving, thank you. Perpetual loop I will sleep to. I need you to expand on that, Jason. I don't know what that means. The oil change?
Yeah.
Can you guys hear my sound effects? Are you hearing these?
Was
No?
it that really quiet? Yeah.
Yeah, here, I'll try again.
Yeah.
Did you hear it that
Okay,
time?
that was.
Oh man, there were so many times I hit the
Bruh.
try again next time.
Yeah, I never heard any of them.
Oh damn. Man, my
That would be an amazing thing if that happened.
there's so many of them.
Do you
Yes.
have a she said sound effect?
That's what she said? No, I have
1 hour later.
there's all kinds of pointless sound effects. I loaded them on this machine to try to be funny, and then you didn't hear them all at all. Great.
I used to have an app on my phone just to make fart noises.